So my name is Kelly Roman. I'm co-founder, CEO of Fisher Wallace Labs, which is a medical device company. And we have developed and commercialized wearable brain stimulation. Some of you listening to this may be familiar with us from the last time I was here a few weeks ago, but I'll give a brief summary and then open it up for some questions. Our overall mission is to bring the most rapid and safe depression treatment to everyone, anyone who needs it. And if you can bring rapid treatment that's safe, and if it's highly accessible, that's going to benefit the patients, obviously, but also the healthcare system and all of the people that rely on that person, whether it's employers or family members. So how do we do that? We started by acquiring wearable brain stimulation technology from electrical engineers, one of whom who had worked at GE, and we obtained a 510(k) clearance from the FDA to treat depression under what was at the time called substantial equivalence standard. A couple of years after that, the FDA wanted to bring a full approval process, require a full approval process, so it would require a large-scale clinical trial. We convinced them to hold off on that for about a decade. A, we didn't have the money for a trial at the time, but B, we convinced them that this device was safe enough that they didn't need to push for a PMA that quickly. So over that next 10 years, and I didn't have any experience in medical device until then, we really learned the business, but more importantly, ended up commercializing a proof of concept wearable brain stimulator, wearable, and sold 100,000 units of it, $40 million in revenue through 14,000 providers. Now, this was a very crude looking device, very inexpensive to build. It cost $36 to manufacture. And by bringing in actual revenue, we were able to fund some small studies. And by the time the FDA said, you have to now go through a PMA process, we were well on our way to that path. So we have recently completed a large-scale clinical trial with 4 weeks of treatment, where we proved that the new version of technology, our version 2 device, reduces depression in the first week. In the first 7 days, it cuts depression in half for about half of all patients inactive, and by the 4th week, 3/4 of patients inactive have cut their symptoms by at least half, with no serious side effects. A couple of weeks ago, so this is new news since my last presentation, our results are accepted by the Journal of Clinical Psychiatry. So that should be coming out, we think, by the end of February. They haven't given us a pub date yet, but we do have the acceptance. And we're using that as the basis to do a final study for FDA approval. That'll be 10 weeks of treatment. And last week, I signed a contract with Mass General Hospital for them to consult, and for Maurizio Fava, who's the head of their psychiatry, head of psychiatry at Mass General, to consult on this final depression study. And we have all of the partners in place. We have a 4-week trial under our belt, and we know that we have better than a 98% chance of hitting a primary endpoint based on that 4-week trial. So we've also worked on making this new device, this new version, very appealing, especially to younger generation, which, by the way, has a much higher prevalence than the older generations. Older generations have it too, but it's almost half of Gen Alpha and Gen Z. And I can bring up here, I'll bring up I'll share my screen so you can see what this looks like. And it actually, I think, looks like something Apple would build. And it comes in multiple colors, not unlike the AirPod Max. And I think, to get back to Apple, class 3 medical devices is not a market that they're obviously in yet, but I think that because of that pressure to grow, they and a lot of other companies are going to have to take a serious look at expanding into these kinds of devices. And so I view them as a strategic acquirer down the road. in terms of potential revenue for this, and we're raising money now, we're raising $24 million to actually finish this approval process and commercialize this device in US and Europe and Asia. And, you know, there's 48 million Americans take antidepressant medication. If by year 5, we sell to 1% of that, that's $250 million a year in revenue. With 1% of the Americans taking antidepressant medication. And this is a device that works faster, much faster than antidepressants, most antidepressants, and doesn't have serious side effects. And it's something you can use at home and is affordable with or without insurance. We're going to pursue insurance reimbursement. We did get Medicaid for that version 1 that we did. And we expect to have broad insurance. It will take some time to get all of the reimbursement lined up. And in the meantime, we can sell, as we did the version 1, directly to patients at around $500 a unit, which still gives us very healthy profit margins. So let me field any questions with the time I have left.
Can you show us again the device?
Yeah, let me see. Oh yeah, sorry. Did the screen share end here? Okay, hold on a second.
So this is the device on the side here on the left.
Yeah.
Right?
Let me see if I can blow that up. Correct. So you can see this is if you can see that. So it's these are it's an electrode on either side of the head. The patient wears it 20 minutes after they wake up in the morning and 20 minutes before bed, and it's comfortable. In our clinical trial, the sham arm had 0 electrical output, and more people in the sham arm thought that they had an active device. That's how indistinguishable the sensation is, and yet there's a big therapeutic difference between active and sham. So very comfortable to wear, and this was designed by Eric Fields, who designed the first Nest thermostat. The Beats pill. This was engineered by Alloy Product Development. That's done all the Beats devices, so lots of head-worn wearable experience, which I wanted to make sure we got this right.
And what's the size of your raise right now? I'm sorry, I'll get to you. We have questions.
24 million. We've raised 12 million to date. Previously, so we've generated 40 million on 12 million raised. And so this 24 million will get us comfortably to profitability. It is designed to be our last raise. Of course, you have to always be careful when you say that, but it is designed to be our last raise. And you know, I think something to highlight here is that we have about 60,000 active users of our version 1 device, right? If all of them upgrade to Oak, that's 30 million in revenue day 1 without a dollar spent in advertising. So I think we have a strong economic case as to why you know, there's never no risk, but we have, I think, mitigated as much risk as can be possible between the 4-week trial, between having a built-in audience for this. And obviously we plan this to be appealing to millions of people, not just our past customers.
We have a question here, Paul.
How is this different from transcranial magnetic stimulation?
How is it different from transcranial magnetic stimulation?
Right. Yeah. So TMS has done, which is known as TMS, has, you know, in some ways was what psychiatrists learned first about brain stimulation. Now that's not wearable. Transcranial magnetic stimulation is a in-clinic procedure. You sit in a chair, psychiatrist brings a high-powered magnet over usually the front of your head. There is a company called Actipulse, which is worth checking out if you're interested in TMS, that is trying to make a home use device, but it's not really a wearable in the sense of the word. So, you know, it's inexpensive, but at least they're trying to get it out of the clinic. But that it's a very different mechanism using high-powered magnets, and is not something that's really made for a consumer level of scale.
So I know you talked about the amount of depression in the United States, but do you any thoughts on what the scale is worldwide?
So in Europe, it's estimated around 1 in 4 adults. In the US, post-COVID, 1 in 3 from Boston University. In a huge market like China, it's interesting because they, as a population, had even more strict isolation during COVID than we had, much more strict. And we know that that kind of isolation really exacerbates mental health issues. Yet, when the data on there, I would say, is opaque. I think it's a much higher problem. I think there's a different stigma problem there as well. So, the US is a great market to launch in, not only because it's the largest consumers of antidepressants, but because we're also very open as a society now about talking about depression. That hasn't happened as much, but it's happening more and more. I think it's definitely trending in a more cultural tailwind, if you will, for this subject.
I guess one of the issues when you take medicines is that there is a decline, a withdrawal when you stop taking the medicines. Is there any kind of withdrawal from using this therapy?
No, we've sold, as I mentioned, 100,000 units. So we've had, there's been plenty of time for any serious side effects to emerge or negative, whether it's withdrawal or none of that has been an issue with this. And in fact, there are substance use clinics that have used our technology, including Phoenix House, to actually combat withdrawal of alcohol patients, drug substance use patients in the early stages of abstinence when they're really having withdrawal issues. So it's quite the opposite, actually. It helps with withdrawal symptoms from other substances.
Great. Goodwin Zeller has some questions. Where is this manufactured? What's the manufacturing cost? Does use of your device in continuation depression medicine improve results versus using the device alone?
So the study we did was our device only. So all I can speak to in terms of combinational effectiveness is pretty much anecdotal. There are many, many prescribers that have done that have prescribed our device in combination with antidepressant medication and have been able to lower the drug from the highest dose to the lowest dose, and also get patients off medication. Not all patients off it, but what's quite common is being able to reduce the dosage on medication. A lot of prescribers have also used this ahead of TMS or after TMS as a maintenance therapy. Same with ECT. In terms of manufacturing, so we're on to our 4th manufacturer now. That's also a benefit of having done this for a little bit more than 10 years. I've learned a lot about manufacturing, and we are working with a company now called Opulent in Malaysia that makes devices for Philips and ResMed. We expect the COGS, the cost of this manufacturing, to be around $70. We have 6 months left of engineering left on Oak. We're using a research version that looks more like our old version for research, but for this one has a higher level of assembly labor and materials, but it should still be under 70. So again, a high margin, and that would be at fairly low volume. That $70 price range is what we expect. That will go down as we grow.
Okay, another question?
We spoke in terms of a 20-minute treatment period. Someone falls asleep a couple of hours. Is there an automatic shut off? Is there a risk to the patient?
So is there a risk if it's longer than 20 minutes, and is there an automatic shut off?
There is. So again, we've learned a lot from the version 1. That version 1 did have automatic shut off. One of the improvement, so there's never a risk of that. And by the way, if there are occasionally patients that think, well, if I use it all the time, won't it work even better? The answer is no. If you use it 24 hours a day, it's not gonna work more than 2 or 3 times a day. But there's no risks to that. The risks are if you have an implanted medical device in your head. So if you have an implanted brain stimulator, we have a contraindication for people with pacemakers because any kind of electromagnetic resonance from a device can interfere with an implanted electronic. So those are more like the contraindications. So was there another? I'm sorry, that was it does turn off. Was there another question there?
The question was whether there was an auto turn off.
Yeah.
There's another. We have another question here. What's your go-to market strategy since it's not FDA approved?
Well, we have to wait for FDA approval. The FDA and Europe have gotten a lot more strict with wellness devices. And so you can't just skirt the medical device regulation like you used to be able to. And there have been venture-backed startups that have tried to do that. But so once we have approval, our go-to-market is, first and foremost, selling to our past customers. That's obvious. We also proved out with version 1, the last 8 months of our version 1 sales, we had $135 cost to acquire a customer CAC. So I view that as the ceiling for Oak because of all the advantages Oak has that the other one did. So digital marketing is to consumers is one. Employers. So we just finished a pilot study with the Seattle Police Department, actually for anxiety, and that will hopefully be our next published study. So we know that police departments are, for instance, very concerned about mental health driving out the workforce. They've had a lot of early retirements and so forth. There's a lot of industries that want to take care of their employees' mental health. And then, as we get more and more insurance reimbursement, then we have more opportunities to sell through, for instance, emergency departments. Emergency departments in the U.S., this is kind of a surprising, maybe some of you, statistic, almost be 1.5 million patients will report suicidal ideation in an emergency department in the U.S. this year. And so when a patient surfaces that, typically the doctor now will have to refer them to see the book a psychiatrist, for instance. That can be very hard to book if you don't have insurance. Even harder. There's delays in seeing psychiatrists. So having something like this, which can be either prescribed on site or telemedicine based. Most of our sales are telemedicine based. Will be a big plus for that kind of in-clinic interaction. And then I think we have, we do have some celebrity users of the device. I can't share who that is. There will always be. We have professional athletes and music stars that have used this. I ship devices to CAA, Creative Artists Agency, and so. I think there's that also part of it that we could develop. I think, we've seen more and more high profile public figures talking about mental health. This is the perfect product, I think, to partner with someone like that on. So I'm pursuing all of these things at once, but the bedrock we know is, we can affordably market and we have that launch in our past customers, which will give us a big boost right away.
So, just as some quick background, my mother was a psychiatric nurse, and she insists to this day that most mental illness is episodic and not constant. So this is something where, so her claim is that a lot of the drugs out there don't treat it correctly because it's episodic, and when you withdraw from the drugs, it causes an episode. But so it seems like your approach is kind of fit for the episode. Is that correct?
It is, and we actually survey our customers, asking them about that. And so our customers a lot of them will fluctuate from using it on a daily basis to using it once a week. 60,000 of the customers use it weekly or more, and about half of that, about 30,000, still use it daily. So their habits will change depending on, they don't want to give it up, because our 77% of our patients say, even when the symptoms go into remission, I'm still experiencing cognitive benefits. And we're actually applying for a $5 million Alzheimer's Research Award right now, because of some of the evidence that's been coming out over the last 2 years on brain stimulation for cognitive improvement, and our customers have been reporting that. And so there is a incentive for them to keep using it. But yes, there's this device, you could put it in a drawer if you wanted to, until the symptoms called for it again. But most people don't want to stop using it completely.
Great. One last question.
Okay, PTSD is increasingly diagnosed for populations, for instance, the urban poor. I was on major refugee board of directors services, and PTSD is extremely common in refugee camps. Is the type of depression and anxiety that are components of PTSD, are they the same as others and would benefit from this?
How does this handle PTSD?
Yeah, so it's a good question. We shipped devices a year ago to Ukraine. It was used in 3 hospitals there with soldiers and civilians. And you know, under an NDA, I could share the doctor reports from that. They treated about 250 patients with our device, and then they treated another couple of hundred with their internal standard of care. All of them had post-traumatic stress. These were civilians and soldiers in an active war zone. And they saw rapid improvements in all of the measures of post-traumatic stress that they were using, including sleep. Sleep is another big one with PTSD. And we have done an insomnia pilot study. We had 48 subjects that wore a sleep tracker for 8 weeks, and we had a sham and an active, and we increased the total sleep time, the total number of minutes per night versus sham by 30 minutes in the first week, and by the 4th week it was 42 minutes difference. And so, you know, sleep is really the gateway in many ways to mental health, and that's something that we're also plan to pursue FDA indication for down the road.
Well, fantastic, Kelly Wilson. Thank you so much. Great job.
Thank you. Appreciate it.